Not seeing any questions. Nancy, are you seeing any questions?
Nancy's on mute, Catherine, but no questions.
Okay, thank you so much.
Catherine, the slides are up, so if you tell me when to move on to the next one.
That'd be lovely. So are you sharing your screen now, Siobhan?
Yes.
Okay, let's do that. Aha, got it now, brilliant. Can you move on to the next one, please? Thank you so much. So just to give you a little bit of context for ACHWS 26, this is an image. Oh, can everyone make sure that they're muted because I'm getting a little bit feedback. If you could just mute yourself. Oh, that's better. Brilliant. Thank you so much, everyone. So just to take you through HAS 2026, I'm just going to rattle through a couple of slides just to give you a little bit of context. This is the opening celebration. So obviously we want to demonstrate participation for people to see, and how we can bring everyone together. Could we move on to the next slide, please? Thanks, Siobhan. So these stats are a little bit about what came out of the last one. So you'll see we did over 300 events. We started with the relay in January and worked through until the week that we held in August. Over 400 artists were engaged. We had many partners, over 122 organisations, from big national organisations to smaller charities and grassroots organisations. And we were really delighted that we were able to kind of set up some government meetings and stakeholder meetings during the week itself. Some things that we achieved was supporting we actually had meetings with the Population Health Framework Development Team, and we now see that social prescribing has been included in there, which we're delighted. And you'll know that Public Health Scotland have now included arts and culture as one of their health behaviours as we move forward into their new policy, which we should hear, their new strategy, which we should hear about in January, February time. So we're really excited about that. Could we have the next slide, please? So the idea for HAS 26 is that this time we're going to really focus on evidence that already exists, systems we know that are working, guidelines that have been created that we know are working, and the ability to leverage some of those, and to have some deep discussions around where we are in Scotland and what's potentially needed. Siobhan, are you able to move on to the next slide?
It's not doing it, so it'll inevitably jump forward about 6 times. So
okay.
I'll try and get it back when it does.
That's okay. I can talk about the themes. So I think one of the next slides is talking about the themes. Everyone will be keen to know those. So arts, health and the environment is one of the themes. Arts, health and technology is another one of the themes. And arts across the life stages is our third theme. So you'll see the themes are quite broad, and compared to, we can just skip that one, thanks Siobhan. Compared to the themes, we had 5 themes for 24, and we thought these ones were much better. They were more umbrella-like. And so just to take you through the week, now obviously everything's moving, but at the moment, if we could pop back to the wee map, we know that on Monday, we've got opening in Aberdeen with an opening celebration. So if you're based in Aberdeen, you want to get involved, just let us know. We've also got Dumfries and Galloway. We've got we've got Dumfries and Galloway, and we've got on Tuesday, we've got Dundee, and we've got the islands, Orkney, Shetland, and other islands that we're reaching out to. Then on the Wednesday, we've got the Edinburgh Local Day. On Thursday, we've got the National Day, so the national conference for everyone. And then that's being held in Edinburgh, hosted by Siobhan at the National Galleries. And then on the Friday, we've got the Glasgow Day, which is being held, hosted by Glasgow City Council at the Fruit Market. At the same time, we've got the Chief Medical Officer's Realistic Medicine Conference happening at the same time. So we're going to do some cross activities between those 2 events. We're not sure exactly how that's going to work, but we've got a planning meeting next week in Glasgow just to talk that through a bit more. Thank you, Siobhan. Can move on to the next one, which just shows a kind of outline of the different events that we had last time and that we're committed to having this time. So the opening and closing community participation celebrations, conferences, government convenings, performances, online conference, which ACHWS will host again, access and inclusion across all events, community workshops, and the national relay. Thank you, Siobhan. And the national relay, I think this time we're thinking about we'll be working with actually engaging hospitals and some international groups, as well as some of the groups that worked on the relay last time. I think that's probably everything from the slides, actually, Siobhan. I think we can close the slides now and just open up, see if anyone's got any questions for me before I hand over to Siobhan to talk a bit more in depth. Oh, we've got a couple of hands up. I can see one from Malini. Malini, do you want to go ahead?
Yeah. Hi, Catherine. Lovely to see you. I just have a question regarding the impact of Healing Arts Scotland, and I was wondering if you could talk a wee bit more about because you did mention, innovation and environment. You did mention the three broader themes, but could you please elaborate a wee bit more on two things? First, what's the impact you've seen in these past 2 years, and what are your aspirations for the next 2 years, essentially?
That's a hard question. I'll do my best.
Sorry.
I'll do my best. I think what I've seen happening is there's been more dialogue between ourselves, leading the arts organisations, with the cultural and health leaders, much more, and Public Health Scotland. And when I had my first ever meeting with Public Health Scotland, they were very open to tell me that they didn't know anything about arts and health at all. And now I'm really delighted that we're seeing that playing out in their approach to public health. So that's wonderful. So that's one of the impacts. We've got a HAS leadership network now, which is working together. And Siobhan and Nancy work very closely together to develop a model for that and what our aims and objectives and what we'll do and what we won't do and what we'll support. We've got the HAS impact report that shows an evaluation that was carried out by Edinburgh University and New York University, and they analysed kind of the professional development impacts of HAS, what people's priorities were for Scotland, and there was a social networking analysis as well. And so because we were the first to do a countrywide kind of data collection in that way, we're going to do it again. We now have similar data collection in Barcelona, Singapore, New York. I feel like there's maybe 5 different areas now where we can compare and contrast what priorities are, where people think strengths and weaknesses are, what people want for the sector. So that was a huge strength. But to be honest, for me, the greatest impact has been us being able to be in one space and start to talk about how we raise up this work and how we start to get better investment, better understanding, and how we use the data that's already existing out there to help us. In terms of your question, just quickly about the future, I think we are really, really keen to see some change in terms of social prescribing being more broadly supported, more community links workers, more investment. And we know that some of the smaller organisations are really, really struggling this now. So just trying to give voices to those working on the front line, trying to think about how we achieve change. We've got a roundtable meeting happening at the end of January where we're going to talk to politicians, but we know there's an election coming up. So, and what we'd really like to do is to set up a cross-parliamentary group for arts and health with Nancy leading on that, from ACHWS with our support. And there's Manira. Hi, Manira, so you got your hands up?
Yeah, thank you. If you don't mind me coming in on the back of Melani's question. So I think I know a number of people on the call already. My name is Manira Ahmed. I'm Chief Officer at Public Health Scotland, but also part of the work that Catherine described from HAS 24 into HAS 26. And I guess from my perspective, just to kind of set the context for us in Scotland, we know our health and well-being isn't improving. We know there's a significant burden on public sector services, and we know all of us, regardless what sector you're in across the public and community sector, the financial constraints are getting tighter and tighter and tighter. On top of that, we also know there is true magic and beauty that happens within arts and culture. Some things we have captured and we know the stories are there, but there is so much more that's still to be brought to the forefront and give it the appropriate airspace. And I truly believe, I know, Catherine, you've heard me say this as well as Nancy and Siobhan, we know that there is now an opportunity where there's that level of political will that's coalescing. We can't continue to do what we're doing to be able to support the nation to thrive, or we can't just ruffle around the edges. We need innovative, transformative change to be able to help us decrease the burden of disease that's due to increase over the next 2 decades, but also for communities to be able to thrive in the spaces and places we're in. Examples of this have already happened across Scotland, so I'm not going to know, you're already, a number of people around this virtual table are part of that. So we know that's happening. And I think what Catherine, Nancy, Siobhan and others around this table as well has done has started to knit that together. So policymakers have started to see the golden thread between what keeps us well, what keeps us safe within a homely setting, and how we can lean into the community actors and players and leaders to be able to do this. And arts and culture definitely focus in amongst all of that as well. But Catherine, I just wanted to say that out loud, and hopefully that made sense to many. Thank you.
I would probably just add, probably reinforcing that thing of what came out of 2024, building relationships with people like Munira and others across. We've got a really good set of people that we've started building relationships with, and that's kind of an ongoing development. And this 2026 gives an opportunity to just push that further, actually give a space for people to speak with each other to decide how we want to take this forward, because this is a collective piece. And also, who isn't already around the table or bought into an understanding of this area of practice, so we can sort of widen that influence.
Thank
Catherine,
you so much to Munira and Nancy. Is there anyone else that has a question? I felt like there was one other hand up that I saw up just before I finish and hand back to you. Any other questions?
Okay. Well, listen, thank you very much, Catherine, for your time. And if you can stay on, that would be great. But if not, we understand. And Siobhan,
I'll stay as long as I can. Thanks.
We hand across to Siobhan. Siobhan, would you like to introduce yourself? And Siobhan's going to kind of talk through how the plans for 26 are shaping up.
Thanks, Nancy. Thanks, Catherine. Lovely to see everyone. I'm Siobhan McConaughey. I'm the Head of Learning and Engagement at the National Galleries of Scotland. We're, as Catherine said, we're hosting the National Conference Day, and we were delighted to be one of the venues that hosted the conference in 2024 as well. And as has been shared already, I've been working with Catherine and many others on this call to sort of see what the legacy of Healing Arts Scotland can be going forward around the nationwide week-long programme of events. But I'm here today just to give you a bit more and reiterate some of what Catherine's shared a bit about Healing Arts Scotland 2026. So just a wee bit of a recap on some of those and a chance for people to come back and ask some more questions as well. So as Catherine has shared, Healing Arts Scotland will follow a similar model to the last one in 2024, in that it will be a week-long series of events that will happen across the country and also online, alongside a national conference. And Catherine gave you a bit of a flavour of some of the events that took place last year, and many of you will have been involved in some of those events that took place last year. So kind of more of that, really, because it was such, as Catherine said, it was such a success, it built such momentum and garnered such awareness and enthusiasm that it feels like the ball is rolling and we need to keep it rolling. So the week, there was a few questions in the chat about the week. The week-long series of events will take place from Monday the 15th to Friday the 19th of June. We'll open the week, last year we opened the week with the national conference. We're not doing that this time, that's coming later in the week. So on the Monday, Healing Arts Scotland will open in Orkney, Aberdeen, Grampian and Lewis. On the Tuesday, There'll be events and activity happening in Dumfries and Galloway, Dundee and Shetland. On the Wednesday, it will be in Glasgow. The Thursday is when we'll have the National Conference Day, which will be in Edinburgh, and we're thrilled to host it again at the National Gallery of Scotland, which will be the one at the Mound, the National at the Mound, where we've got conference facility, well, a lecture theatre there, overstating it a little bit, conference facilities, but a lecture theatre there. And then on Friday, the Healing Arts will stay in Edinburgh, but it'll be focused on activity and events that take place in and around Edinburgh and the Lothians. The days are all still in the development phase, and there's small groups of people shaping and coordinating each of these days. So if anyone here or you know anyone who would like to get involved or make suggestions, please do email Nancy and she can pass that on to the relevant person. This isn't a closed shop. It's its success is in its strength and diversity of everybody who's involved in it. So please absolutely do feel that you can participate in the planning as well as the delivery of the week. In the week before this, there will be an online conference that ACHWS will develop. And during the week, again, Catherine briefly mentioned this, on the Wednesday is where the Chief Medical Officer's Realistic Medicine Conference in Glasgow will also take place. And as Catherine said, there's work underway to explore how this conference and the HAS week can connect to mutually support each other. I hope you can also hear me. Did that break up?
Sorry, Siobhan, can I just jump in? It's actually on the Friday. It's the Glasgow day, the Realistic Medicine Conference.
Sorry.
Remember, we had a change.
I do, but thank you.
That's okay. We can hear you really clearly.
Okay, I just got a message saying low bandwidth, but that's maybe just my brain, not the computer. So as with last year, there'll be an open programme enabling anybody who wants to get involved and to do their own event to do so. And these would then be listed on the Healing Arts Scotland website. So as well as the sort of programme across the days that I described, there's also an open call for anything and everything to happen right across the country. There'll be a call out for events in January. Anyone who's registered for this event today will automatically be informed when it goes live. So do look out for that. But just as a heads up, it'll appear, that call out will appear sometime in January. Catherine mentioned, but just to say again, just for in terms of the themes. So the three key areas are arts, health and the environment, innovation in arts and health across the life stages. And these themes are there with a view to really exploring and identifying clear pathways to implementation, embedding and scale. These themes we hope will give enough scope for the variety of work that takes place that everyone can align with and connect with the sort of key frameworks that has been shared, such as the population health framework. So as with last time, we hope there will be a lot of engagement across the sectors of arts and health and the arts and health sector, whether it's by attending, by participating, advocating and just spreading the word. We really hope to build on and solidify all of that political engagement that was achieved through Healing Arts Scotland 2024, and we're sure that the learnings to come and the connections that are made and the awareness that's raised will be something that we can all individually and collectively use to progress this going forward. So I hope that's given everybody a sort of recap and a bit more on the basics of what's happening. And enough to start your thinking and possibly planning of how you might want to get involved. But I'll stop now because again, there might be some more questions based on that, on anything that you've heard or want to share or are just starting to think about. So thank you.
Thanks very much, Siobhan. We are recording this. I think there's been a couple of things in the chat just asking about sharing. So at the end of the conversation, we will put this up on our YouTube channel. So if there are colleagues or networks that you're working with where you want to share some of the information about healing arts, that will be available. But in the meantime, if people have got questions for Siobhan or just generally anything else that they're wanting to know about what healing arts is, how to get involved with it, why to be part of it, and like Siobhan said, what we tend to do for Healing Arts is, where there's some really great speakers going on in rooms around Scotland at the different conferences around the different places, we try and draw some of that together and do an online conference programme so that anybody, wherever they're based in Scotland, has an opportunity to hear and be engaged with some of the key topics and speaker sessions. And we would then also encourage, if there's anybody that wants to do their own activity, I think, like Siobhan said, that the map of putting on your own activities will open up in January, and we'll send that information out to everybody in our network, but also specifically on this call. So you'll get details of when that kind of list. So the listing is anybody who wants to do anything themselves, anywhere in their area of practice, they can list their own events. And then there is a program, a slightly more curated program of events going on in certain places. And then there'll be a curated online sort of program that's available. Mike.
Thank you. It's been really interesting and helpful to get a bit more flesh on bones that were around. And apologies, Siobhan, I did actually have the dates in my diary, I just hadn't looked. No, it's really relating to the realistic medicine, because I was very pleased at CMO's commitment to this, the Chief Medical Officer, for those not in the medical world, commitment to this, certainly in the 24 event. The fact he's tying this in with realistic medicine, does this mean that he is actively communicating this out to health boards to try and promote this across the health service as it is? For all the reasons that Munira said, you know, they are under pressure, and persuading them that this is actually a huge beneficial investment with a massive return on a very small investment, if we can get them persuaded to actually just take that forward. I don't know whether it's Catherine wants to respond to that, or Munira come back.
Hi, Mike, I'm here, but perhaps both of us can pick it up. And I know Safia Qureshi is on the call from Healthcare Improvement Scotland as well. Essentially, we're working with the realistic medicine team so that we can have cross-pollination between the two events on the Friday. But the realistic medicine conference has been purposely programmed in that Healing Arts Week for that reason. And we'll have a keynote speaker. I think we were hoping it would be Professor Daisy Fancourt, but I'm not sure who it will be. But someone that can talk to exactly what you're talking about, which is the economic impact of this work for health. So understanding what money we can save by using the arts to improve public health and individual personal health, you know, and community health. So in terms of communicating that to the health boards, I'm not sure, to be quite honest. And I mean, you know, colleagues that are working for the NHS and leading this in the NHS are working very hard to get their senior leaders along to the Realistic Medicine Conference. And, you know, there's endless effort in that space. But that's certainly something that we're continuing to discuss with him. But I'll hand over to Munira to see if she's got anything she wants to add, or Safia.
Safia's here. Safia's got a hand up.
Safia's got her hand up.
Hi everyone, I'm Safia Qureshi. As Catherine said, I work for Healthcare Improvement Scotland, which is one of the national health boards. One of the things we do is draft evidence-based guidelines, which is a way of communicating to healthcare practitioners what is recommended practice, what's best practice. And we've been exploring with the CMO, the Chief Medical Officer, this idea of doing realistic guidelines, something that is in a slightly different space to how do I treat asthma, for example, which has been a sort of standard fare for us. And so this is a very early trial. We are looking at, could we do a realistic guideline on arts as a health intervention? So at the early stages, it would be very fast if we were able to have something ready for June, but we will have something to talk about by June. So Mike, it's coming from our perspective, and obviously, as Catherine said, the conversations happen at the sort of realistic medicine groups, and they are trying to disseminate this as much as possible, but we'll have something concrete to share, hopefully through a realistic guideline, which will be a first, so another first for Scotland.
Oh, just before I finish, one last thing is that obviously, again, people may not be aware of the complexity of the governance of the health and care system. But whilst government and NHS boards lead with a lot of the mainstream medicine stuff. Part of the challenge is also the health and social care partnerships, which are co-owned by the councils. So if I could just add a caveat to its communication with the boards, but also to the health and social care partnerships. Thank you.
And I was going to say it's actually very nice to have a call which is in some ways very health related, because I think sometimes we can get very stuck in the culture, arts and culture kind of conversation. It's really nice to have such a mix of people and have some real, and I think that's um, one of the great things that came out of the healing arts is how this has brought people together to be having a much stronger conversation across arts, culture, and health in Scotland. We've got Catherine and then Ken with their hands up.
Hi, it was just to say that I just noticed Siobhan saying a realistic medicine guideline, and it would be really amazing. Is that the realistic medicine team they've asked for some examples of case studies. So I'm sure there'll be people on this call that can rustle up a case study or two with some photographs to go in the realistic medicine brochure for the conference. So if anyone's interested, please do get in touch with Nancy or myself, and we'll pick that up. Thank you.
Yeah, we're working on a case study bank just now. So again, yes, I've done several call outs, but if anybody has got a case study they would like us to pull together and work on, have part of, as part of the evidence bank, please get in touch and we can work that up. Ken.
Yeah, I just wonder, I'm not sure about who the best person would be, but just if someone could talk a little bit more about the themes, arts, health and environment, technology, innovation, and across the life stages, how you see those feeding in and informing the festival.
Yeah, I don't know, Catherine, do you want to pick that one up? Or Siobhan?
Yeah, I can start and then I'll hand over
Yeah.
to Siobhan, but I just wondered, Nancy, of course yourself, you might have some thoughts as well. Essentially, the themes are umbrellas, Ken, because we felt last time that, well, Nancy fed back to us that the feeling was that the themes that we'd had last time were maybe a bit too specific. For example, dementia was one of our themes, youth mental health was one, and we felt, and social prescribing was one, we felt it'd be much better to have more broader umbrella themes. So in terms of arts, health and the environment, we're thinking about arts activities that take place outdoors, whether they engage, whether they're exploring the impact of the climate on health and mental health. So it could be a really wide range of things. We're really excited to connect with Public Health Scotland on their sort of assessment of all the green spaces that the NHS holds across Scotland and how we can use those better. And then in terms of our arts across the life stages, thinking of everything from, postnatal and pregnancy, arts and health work right through to a lot of the work that we all do with creative aging and health in that way as well. And not forgetting sort of working adults in the middle. So anything there. So that's a really nice space. And also really would love to see some intergenerational work happening there. And then the last one, arts and health and technology, is really just to give the space to those who are working in that space. And for us to really have a dialogue around where technology is useful and where it's not useful. And just have rigorous discussions. So that is my understanding of themes, but keen to hear from others as well. And I'm unfortunately I'm going to have to go into another call now, but I'm really delighted to meet you all and to have had this space to chat. So thank you so much.
Thanks, Catherine, and thanks for your time. So Ken, I'd maybe just pick up from Catherine. I think because in 2024, Healing Arts Scotland was obviously the first event that we'd done in Scotland. It was also the first event that was done countrywide. And I think the original themes were very specific, and it felt like those not working in those specific areas didn't feel necessarily included in the wider programme. So I think that was partly the choosing some very broad themes, but at the same time choosing themes that right now there is quite a lot of work going on, or there's quite a lot of potential for joining up. So they were areas that allowed for the majority to feel like there's something that's relevant to them and their practice. And it also allowed us to be able to look at some of the speakers that we might be able to focus on in terms of some of the innovation or new things that are happening in some of these spaces. So they are very broad, and they're deliberately broad. But there are some, I think, for example, where Catherine mentioned, where we're looking at with Public Health Scotland around green space and green spaces and what that might look like. Some of this will also help post the event to actually develop some more connections and embedding arts and culture in wider strategies and areas of government, or in some cases enables us to open a conversation that so for example, when we're looking at physical movement, we can open some of the conversations around, does that mean walking and sport? Or does that actually, again, where does arts and culture fit in some of the areas of practice that right now we're not visible in? So some of these are kind of door openers to be able to sort of post the event. Obviously, Arts, Culture, Health and Wellbeing Scotland is here all year round. So this is a great platform. And some of this is to then spark off things that we can keep moving forward across, in between the events or after the event. So Arts, Culture, Health and Wellbeing Scotland at the moment is developing an advocacy policy group. There's going to be an online open conversation at the beginning of February where we're just looking at how do we articulate on, from across the network, how do we draw the voices in and how do we represent. There is a research group that has been set up and beginning to meet, looking at what is going on in Scotland, who's involved in research, how can we join up and work more effectively together. And I think we're going to be pulling together a members group who will help us shape what ACHWS does across the whole year. So there's quite a lot of development work that we're doing right now as a network. And then for us, Healing Arts Scotland is a fantastic opportunity to platform and spotlight and showcase activity and bring people together. So I think last year there was even things like the regional activity. Last year, I think it was Aberdeen, Orkney, Edinburgh, Glasgow. This year, obviously, there's more than double. The Dumfries has come forward, Dundee, various other places where they're looking to use this as a catalyst in their own local area to pull people together, arrange some kind of gathering. Some of them will be kind of like a conference, others may be, so each of the regional ones will have a different flavour because they're being arranged by those in that region for those in that region, and this is the opportunity and the catalyst to bring it together and do it. And one of the benefits will be some of the speakers we've got kind of who are involved with the conference, a few of the international visitors will be able to be kind of programmed in and support what's happening at the regional events as well. So I think that was where we're at just now. Is there are some people involved in the planning group. It is always open for new people to join. If anybody actually wants to be part of shaping Healing Arts Scotland, let us know. Some of it is about ensuring information is coming out so people can think about what they might want to do themselves for their own organisation, their own practice or their own areas. It's also flagging up some of the locations or the regions that are already pulling things together, and we can put you in touch if you're in those regions and want to be involved. If you're not already, we can put you in touch with the group on the ground who are doing all the different regional events. So really today was just to sort of flag up it's happening, try and give enough information that whatever your involvement or interest might be, you've got what you need to be able to go away and decide what to do with it. And also just mark it in your diaries, so that it's coming. There will, as I said, I think Catherine mentioned, there's going to be a launch, a roundtable discussion launch event at Parliament in January. And then there'll be information coming out about the map opening up and more details on all the different events. And then there will be the details about what's happening at the conference and how to sign up for it and everything as well. So it's really just a precursor across the network to let you know what's going on. Are there any other questions, comments, observations, Siobhan?
Just whilst I'm on the call to take advantage of that space, I suppose, just to say if anyone, myself and a few others, Len McCaffrey and others, are organising the Edinburgh and Lothians Day on the Friday. If anyone wants to help share their ideas for what that day should be, we have a consultation session happening on the afternoon of Wednesday, the 14th of January. So if anybody wants to come along to that, it doesn't commit you to planning the day in June. We're just keen to hear what people would find most useful for the events that will be taking place that really have that spotlight on Edinburgh and Lothians. So if people are interested in coming along to that consultation session on the afternoon of Wednesday the 14th, just get in touch via Nancy, and then we can invite you along to that. It's not the one and only chance, but it was quite a good point to just hear what would be of most value to people.
And there's similar dates for Glasgow, Aberdeen, etc. So again, if you're anywhere else in the country and you want to link into the discussions in your area, let me know what area you're in, because I think there's online Glasgow conversations as well as the online Edinburgh ones, etc. So just get in touch with me and I will sort of try and draw everybody together. Is there another? Just going to keep an eye on the chat as well. And then, so in the chat, I'm just having a quick look through. Who do you email regarding over events in Scotland? So I will be initially a point of contact to be able to kind of plug people in. Once it's launched and up and running, there'll be contact details about how to register your events on the Healing Arts Scotland website, and finding out more about the Healing Arts Scotland events. That will all come out with contact details. This is a collective of a number of organisations, so the centralised kind of comms will be starting off in January, February time. So let me just see. We'll be delighted to share a call with our members working with the libraries. Okay, realistic guideline, amazing step. We'll be looking for practitioners to be involved in the development. So that's just Safia talking. When Safia was talking about the realistic medicine, they'd be looking for practitioners to be involved in that development. So again, if that's an area that you're interested in, or you'd want me to forward details on to Safia, just again get in touch. So if you're emailing, just let me know what it is you want me to do, and I will endeavour to try and sort of patch all the different bits to the right places. I think one of the key things here is no matter how well networked people are, there's always people out there that might want to be part of something, and that's where we felt an open conversation with anybody will allow everyone to have the same level of information and decide how they want to engage with it. Just see if there's anything else in the chat. I will need to check out with members, but I'm now a member of the RC. Oh, that Mike, especially. Okay. Yeah. Okay. Is there anybody want to ask anything else? Comment on anything else? Just out of interest, how many people have already been involved with healing arts, or already have an awareness of healing arts? If you can do a show of hands, just I'm trying to get the who knows about it already and who's joined the call because they weren't really aware of it. Okay, so we've got a good number of people involved in some ways already, and there are a few. Brilliant. Fantastic. Well, I said we're looking forward to it. I think there was I think it's fair to say that Healing Arts Scotland came together because of a huge number of people putting in, seeing a vision, and I think in Scotland that thing going, we'll find a way to get it done. I don't know how many times we had that sort of, we'll find a way to get it done. And that 2024 was an amazing platform. We're building up to 2026. And again, I think there's an element of this can be whatever you want it to be if you want to become part of shaping it. So yeah, let me just see, Melina, have you got your hand up again?
Sorry,
Hello.
it's just
That's okay.
hello.
Hello.
While I don't have a lot of awareness about it, I think I was part of a meeting earlier, and Jackie Sands had introduced me to Healing Arts Scotland. So in my own practice, I do work a lot with refugees, and I'm part of the UNESCO Refugee Integration Through Arts, Language and Education group that's based at the University of Glasgow. And while it's a collective of artists, we do work in the intersection of creative health and refugee integration, essentially. And I was wondering if, I know this will require a little more conversation, but if you could, Nancy, tell me a little, if you could tell me some ways where we can integrate more refugee creative health, like, migrants, refugees coming in. How can we sort of like integrate Healing Arts Scotland with with this practice, essentially? I'd be very interested to know that from you.
Well, I think there's probably two things I would say. One is in last year's programme, we had quite a lot of in fact, one of the themes last year looked around sort of migration and the various other kind of topics, which meant we had online conversations with various speakers in the rooms, talking to a lot of this. So again, I might see if I can look up some of the stuff that was done in 2024 that was in that space. The other thing is in all of the regional events, while these programs are being developed, there is the opportunity for to put forward who would you like to see in the programs, who would you like to hear from, showcasing practice. I think as well, some of the work that's been, so with the Healing Arts Scotland hat on, I would say it's up to individual organisations, if they want to showcase their own work in their own ways, that would go into the programme that you can that you would just upload what you're doing and it would be publicized through the site. If you actually want to see it as part of the core programming, join either one of the regional groups or even the HAS sort of planning group, because that helps just broaden out the voices and in terms of that. In terms of Arts, Culture, Health and Wellbeing Scotland, we're here all year round and are constantly looking. We do online conversations, we bring people together, we lobby, we provide case studies, we're involved in all kinds of conversations. So I would encourage anybody, if you want to have a chat with me about specifically your area of practice, the kinds of things that you're looking to do, we can work out how that can be amplified across the network, how we can represent that in some of the other conversations we're having. We do a lot of kind of joining people up who are maybe doing similar work or facing similar challenges, and we can link people up to have conversations with each other. But I think going back to the work that's being done just now with Public Health Scotland and the NHS, and specifically the Chief Medical Officer, I can't tell you how desperate I am right now for people to share case studies of good practice, the impacts, because if we have the interest just now and what they're looking for is evidence, there's phenomenal work going on across Scotland, amazing impacts, but we can only evidence that if you share it with us. So I would ask if people could have a think about whether there's a way they could share that throughout the rest of the year. outside of the Healing Arts platform, there's also an opportunity to create conversations around any specific areas or topics. So Melina, I think if we pick up on that outside of this, if that's okay, and I don't know if that is useful to people as a quick summary.
Oh, thank
I'm
you so
sorry,
much. That was very useful.
I'm always a why use 10 words when you can use 100. So
No,
I do
no,
apologize for that.
that was very helpful. Thank you so much, Nancy.
Okay, I'm happy to draw this to a close unless there's anybody else would like to ask anything, comment on anything, add anything. No. Great. Well, I look forward to hearing from lots of you. I look forward to seeing most of you, hopefully, across Scotland in June at some of the Healing Arts events. And as I said, we will be sending information out on a regular basis as things develop.
Thank you, Nancy. Happy New Year when it comes.
Thank you.
Thank you.
Thank you, everybody.